I'm Dr. Craig Schmidtke, and I'm the founder and co-creator of ORCA Pain Relief Putty. Today we'd like to take a few moments to instruct you on how to utilize the product to your maximum benefit and how to make things much easier for you and how to optimize its use. What you'll do first is you'll take the ORCA package and remove the tube that's inside. You will also find an instruction sheet that goes over all the application process and storage process of the ORCA Pain Relief Putty. Opening the tube, there is a hermetic seal across the top of the tube that has a perforation which allows you to access the cap. Once the cap is removed, there is an aluminum foil that protects the product even further, giving it air seal. The bottom dial of the tube then is rotated in a clockwise fashion. Understand that the material is much different than a standard lip balm. It's much thicker, and therefore turning the tube too quickly may in turn break the mechanism that's on the interior aspect of the tube. Be patient, it will come, it will start to balloon and bubble up towards the top, and once you have approximately 1/4 of an inch of material, just take your finger, obviously after you've washed your hands, and remove a small bolus of the material, rolling it into a small ball. So obviously the application of the oral pain medication, as you can see, it's quite sticky, and so we're obviously wearing gloves and a mask at home in utilizing the product. You wouldn't necessarily have to do that. I'm just wetting my fingers slightly so that it doesn't stick to my gloves. It would behoove you to utilize a small amount of saliva or a little bit of moisture to do that. But then trying to dry the tooth area, obviously she doesn't have a cavity here, but if she were to have pain in these two teeth in this region, taking the material and gently pressing it into the spaces around the tooth and ensuring that it's up along the gum line as high as possible like that is ideal. And then just allowing that to sit in that area, as you can see here, using the spaces in between the teeth to help hold that. Obviously keeping, again, up along the gum line. In turn, then just allowing the lip to drape like that, allowing the material then to dissolve. Occasionally you may want to spit. The taste is quite intense. Once the tooth that has been had the chance to dissolve, you'll see that the area will create a significant amount of pain relief. Oftentimes there can be a small burning sensation or tingling at the outset. That's okay. Obviously then, as you can see, after a few minutes it's starting to dissolve, and in turn she should experience significant amount of relief. Then taking the tube, rotating, you'll be able to lower the mechanism slightly such that it'll allow the cap to go back onto the tube and allow the material then to settle slightly such that it doesn't dissipate into the cap. Then placing the tube in its upright position on the countertop for storage would be optimal. If that doesn't happen, it's not a problem, but you may end up seeing a small amount of material drift into the top of the tube. Not a big issue. Using a toothpick, then you can retrieve any of that that's maybe stuck into the tube and use the product as directed. We hope you find ORCA as helpful and relieves your pain like so many people have. If you have any questions or concerns, please refer to the website orca-products.com. There's a plethora of information there that will help you learn about ORCA and also help you get through the process of alleviating your dental pain.